I am so delighted to welcome Dr. Lori Leach. I'm Cinda Rushton. I'm the Bunting Professor of Clinical Ethics at Johns Hopkins University in the Berman Institute of Bioethics and the School of Nursing. And Dr. Leach is the founder and director of an incredible program that focuses on helping people manage crises and trauma. So, Dr. Leach.
Thank you. I'm glad to do this with you, Cinda. It's really fun to have a chance, not just fun. I mean, I feel a sort of mission when people are in such settings of distress and uncertainty to have something to offer that I think is simple to use, but quite profound in its ability to shift people into states that are healthier for their immune system. So I'm glad to be here with you.
So we are going to apply some of the elements of the social resiliency model to some of the common ethical challenges that are highlighted within the COVID-19 crisis. And we've already done an introductory video that if you want more information about the model, I would encourage you to take a look at. But for today's segment, what we are going to focus on is the issue of moral distress. And as a nurse, I have spent a lot of time with my colleagues exploring the kinds of situations embedded in this COVID-19 crisis that are actually challenging them from an ethical perspective. So for example, many people are feeling distress around how do I actually honor my ethical framework for individual patients, which is focused on their autonomy, their insights into balancing benefits and burdens, in a context where now I'm being asked to enlarge my ethical framework, to prioritize in a different way the common good. And with that is a greater attention around issues of justice and fairness and equity. And how do we allocate the resources that we have in a way that benefits the people who are most likely to benefit from them? And that shift really creates a kind of dissonance and tension, and it can leave us feeling as if we might be abandoning our patients, when in fact, what we're being asked to do is to actually enlarge our ethical framework in a different way. What that does is it creates a sense of real distress that what we're actually doing and what we think we ought to be doing are out of alignment. And that's where the distress comes from. And we wonder, how can I have integrity in the midst of these situations when I feel this tension can't really be resolved, because quite honestly, we don't have the resources that we need to treat people in the way that we're used to. And that shift in not having the resources, we're a very well-resourced country compared to many others. And we're used to having the resources for whatever patients ask us to do. But now we have to have limits on that. And so it can leave us feeling distressed and having, at the end of the day, a kind of moral residue where we feel sometimes guilt, we may feel remorse, or kind of moral failing. And so as we try to address those issues, certainly there are lots of ways that we can think through those issues. But one of the pieces that we wanted to include in our repertoire is how we can actually use the wisdom of the body to help us be able to manage those situations in a way that doesn't leave us quite so depleted or feeling so despairing. And so what I'd like to do is to ask Dr. Leach to speak about the social resiliency model a little bit, and to help us think about how we might use one of those skills when we're in the midst of a morally distressing situation. What would you recommend?
Okay, so I think the first thing that comes to mind is skill, but it's also a concept from chemistry, which is titration. And titration simply means a little bit of one thing and a little bit of another thing and a little bit of one thing, so that if we're making a compound, we don't just dump compound B into compound A all at once. And typically when we are going through such gigantic questions and moral dilemmas and moral challenges, we need to figure out how to titrate what we're dealing with in a way that helps us both stay in touch with our consciences and our capacities and deal with the reality of a situation. And so it might look like this. So you're faced with this moral residue as you finish your day, and it can seem like that's all there is. Your whole attention is focused on how indignant or how grief-stricken or how ashamed or how what other big feelings that you have about what's gone on during that day. And knowing that there is definitely a reality base to it. It's not like this is some made up thing. So many people are facing this challenge of a moral residue. And yet, if you can work with your attention in these ways that titrate how long in one stretch you're in that moral residue, and then come back to it when you need to, you can create a much greater stability in your nervous system, which means that you'll think more clearly. You can make better decisions about how you advocate for yourself and your patients, how you respond to your families once you get home. And so it might look like this. So you get in your car and you start your litany of all the things that went wrong, or you're really sitting with one particular incident that just felt terrible to you. And maybe you even have an attitude about one of your co-workers because of their way of participating in that. And your attention then is riveted on that. That's your amygdala again. We talked about that in the first session. Focusing so heavily on it that then you start to feel that activation level rise in your body. And if you're tracking yourself, you know, how is it even showing up? Is your heart pounding? You know, do you have a pain in your temples that's just the pain of tension? Is there muscle tension associated with it? So you know when you start to sense those things. Or are you completely shut down and you don't notice anything? You're just really, really mad or grief-stricken, but there's nothing that you're aware of in your body. Those extremes are not good for you. So in the way of using the skill of titration is to say, okay, so I'm going to name the piece that's really gotten me to this state. I'm just going to name it. And then I'm going to shift my attention away from it for a piece of time on this trip home. Who am I looking forward to seeing at home? What am I looking forward to eating for dinner, if it's that kind of thing? And if it's hard to do that, you can shift back in time to a time maybe last week where I was in a situation that I felt really proud of, because those situations are also happening now. So we can use time. So what was happening last week or yesterday or in the morning before the afternoon took over that gave you a sense of, this is why I signed up for this work. This is what my purpose is on the planet in this moment. And that's not enough to just think about it. You drop it into your body and say, and as I really review all the details of that, I force my amygdala's attention to go to all of that piece that felt so good or that reminded me of who I am as a professional. You notice what starts to happen in your body. Does your breath deepen a little bit? Do your shoulders lose some of that tension? Or is the pull in your temples a little bit less? So if that's a good sign, that's a sign of your resilience. And we're all wired with the potential for it. It's just that we have to direct our attention in these ways that override the amygdala's focus, that inhibit the amygdala's focus on what's negative. And once you get into a better balance, so then your attention can go back to that residue. but you stay in it just a little while and then you go back to something else. Or you can go forward. What do I want it to look like down the road when we're further out of this situation? How do I want to imagine myself at a patient's bedside once these restrictions are loosened on us? And you take yourself into a future where you can be your absolute best self. And you notice that. You just sense into it. It's like taking a tonic for your body to allow yourself to think forward or back in ways that begin to bring your activation, your stress level down. Cut off the stress chemicals that are so toxic. So the skill of titration is really a wonderful tool to have because it says just a little bit of the hard stuff, balanced out with a little bit more of the positives. And then you can always return. This is not about let's pretend everywhere in la la land and everything is happy. It's not that at all. It's only saying we need balance, and we can have balance by how we manage our attention.
So this is a great resource for us. And I want you to think about, the scenarios that are causing you moral distress. It might be because, for example, families are not able to visit now in the ways that they have been able to visit in the past. We have examples of patients dying alone, which for many of us is just heartbreaking because it's so contrary to the way that we usually provide good end-of-life care. And so we feel like we are somehow failing. It might be that, we have to say no to patients' requests. We just can't actually honor them. So this skill of titration gives us a place for us to be able to recognize and name the reason that this is causing me distress is because my orientation for my patient is to actually honor their choices and their preferences. And right now I can't do that. And that's what's causing the distress. So naming that and then being able to shift and titrate how much of that sense of distress, that sense of regret, am I able to hold right now? And to use the skill of titration to give ourselves a little bit of more ease in the midst.
Well, and I would add, Cinda, that it's to shift the focus from what I can't do, which is reality-based, to what I can do or what I have done. And so if one of the things you can do is to maintain a caring and sacred presence for a few moments, that's a can do. And just notice that. Or, whatever else. But again, the can't do mindset is the amygdala's focus on threat. And what we want to do is shift to also, just side by side, also, what can I do or what have I done or what will I do in the future?
So this shift in including in our on our awareness and our framework, what we actually have done, what we are able to do, doesn't deny the very real constraints and limitations we have. But at the same time, it does give us more resources to be able to continue to do our work. So I want to thank Dr. Leach for joining me to discuss this issue, and we look forward to inviting you into further segments of this series. I'm Dr. Cinda Rushton, the Bunting Professor of Clinical Ethics and Nursing at the Johns Hopkins University, and I'm joined today with my colleague, Dr. Lori Leach, who is the founder and director of Threshold Global Works, which is an organization that is dedicated to helping people heal from trauma. So today we are continuing our series, looking at how we can actually use some very practical skills to address some very common moral and ethical issues that we're confronting in the context of the COVID-19 crisis.
Mhm.
So today, we are going to focus on the issue of moral outrage. And I doubt that there's any person who is not experiencing moral outrage, that sense of violation of some important value, a sense of injustice that has occurred either toward ourselves or toward groups of people. And the often anger and energy that goes along with that recognition and how it impacts us. You know, in many ways, moral outrage is an expected and often justified response to a real or perceived violation of an important ethical value, especially things like justice and fairness and equity. And so it's not as if moral outrage is, you know, something we want to try to extinguish in any way. But rather, how do we use moral outrage in a way that can be constructive and actually motivate us to progress, to come up with solutions, to acknowledge the very real value conflicts that are in front of us? So one of the common ones in my world as a clinician and a healthcare provider right now is around the availability of personal protective equipment, or PPE. And I'm sure people have seen on the news and in all kinds of publications the sense of moral outrage that goes along with the recognition that we actually do not have sufficient amounts of PPE for our frontline healthcare professionals. And as a result of that, many of them are experiencing extreme degrees of risk in terms of their own health and that of their family. But sadly, in addition, we are seeing clinicians who are developing the COVID-19 virus, and some of them who are dying. And so the outrage is really fueled by how is it that we can have a healthcare system that asks our clinicians to put their own health and well-being at risk in order to serve the health and well-being of all the rest of us without having the kind of equipment that actually decreases the likelihood that they will be either infected themselves or harmed by contracting the virus and potentially dying. So I'm wondering, Lori, if we could talk a little bit about how the social resiliency model might offer some tools for how we could approach our moral outrage in a way that might be a little bit more constructive and a little less exhausting.
Okay, well, that's a big question, huh? And just the word outrage. I mean, when I hear the word outrage, much less know what you're applying it to, so I can even see the scenes, and I can start to feel in my own body that constriction, because I felt outraged myself watching the news, hearing from people in my world about what's going on and how can this happen. So that word outrage immediately makes it really big. And we know that as soon as it's named that it comes with a lot of other things. And so from this neuroscience-based model, we can talk about the slow and fast system of information processing. And in the slow system, it means that no major threat has been detected by our little smoke detector, the amygdala. And we can operate in this sort of congruent way where our thoughts and our feelings and our sensations are all fitting together, and we're in what, in my model, we call the resilient zone, the R zone. And in that slow system of information processing, we can think clearly and strategically, and we can make really good decisions in our own behalf and in behalf of others. This is in contrast to what happens in the brain when we have a situation like outrage, where we go immediately into the fast system of processing, where the stress chemicals that are produced block access, full access to your cortex or thinking brain. So this is a kind of scientific explanation of something that's horribly personal to so many people, but it can help to understand what's going on and why it's so important to have some tools that you can use in your own behalf. And so when the stress chemicals start to block clear thinking, we can forget about things, we can lose things, we certainly have an escalation of emotion or shutdown of emotion, either of which isn't good for our work, but also for our immune system, which is a big focus of mine. And so the first step is when you're in a state of outrage, you're already outside of that zone. And so cognitive strategies are generally not going to be too helpful. The worst thing somebody can say to you usually is calm down. It just makes you all the more furious because your fury is grounded in a reality. You deserve to be outraged about it. It's just that you can't act strategically, both in your own behalf for your health and your professionalism, or in behalf of others. And so what can you do? The first step is that to just notice. If you notice that you're constantly going over and over and over what's gone on and getting more and more activated by that, that helps you know that you're getting into that state, and you can begin to do something else. You can at least give yourself a breather by shifting your attention. In this model, we work with the power of attention. It's a powerful tool that we have, and we don't pay enough attention to it. So that whatever we pay attention to is going to create the climate in our body. That's the simplest way to say it. And so as you notice that your outrage is present and active in you, if you can simply take a step by focusing your attention down to the soles of your feet being supported by the floor, that small, the soles of your feet being supported by the floor, and just sense in that moment. Nobody needs to know you're doing it. You can be in the middle of an ICU. You can still maintain your focus, your visual focus on what's needed of you, at the same time as you send your attention down to the support of the floor underneath your feet. And you just push in a little more deeply, just to remind yourself that you're being supported by the floor. And for many of us in that moment, and particularly if you practice this as simple attentional skill, grounding, you begin to notice a little lightening of the sensory experience of outrage. You may take a little deeper breath just for a moment. You may feel as if your shoulders drop. You may notice something if you're tracking yourself at that sensory level. If you don't notice a difference, then it's important to shift your attention in some other way. So maybe you shift your attention to a coworker across from you, and you notice how hard she's working to try to correct a situation. And you notice that she's diligent about what she's doing, and then maybe she meets your eyes. And in that moment, you have that brief human connection of, we're in this together. You matter to me. And you just allow that to go into your body in a way. You take it in at that sensory level, that human connectedness. And you just stay with it for just a minute. You put your attention there. And as you notice your activation level dropping a little bit, your thinking, your better ability to think will come back online bit by bit. You can participate in decision making in a way that isn't so reactive. You can advocate for what you need from a much more constructive place, because nothing in learning to manage moral outrage is about the fact that you have no right to be outraged, because you have every right to be outraged. It's just that, does the outrage serve you? Either serve your own personal health, emotional and physical, or serve you as you try to do the best job you can do with what you have. And so that's what's important to remember, is that in using these attention-based skills, it's not because we want to try to make some reality go away. It's only that we want to embed the reality in something more that balances out the toxic toll it takes on your body, on your mind, on your capacity to act strategically in your own behalf and in behalf of others.
So this skill is a really important one for all of us right now, because I think the tendency and the opportunities for moral outrage are ever present. And we're in a situation where we could easily become completely depleted by allowing the moral outrage to actually stress our system even more than it's already stressed right now. Mm-hmm. And so, as Lori was describing, part of the reason to use these skills is so that we can actually get ourselves back into our resilient zone, where we can perceive the situation clearly, be able to connect it to our ethical values, to be able to name why this is so outrageous and wrong, and then to be able to decide to choose. Because when our amygdala is taken over, we're not in a good position to choose, because we're often in autopilot. And so when we're in autopilot, we're more likely just to spew our anger everywhere. And that might feel good in the moment, but the consequence can be that we actually cause more harm to ourselves and more harm to others. Because if you think about being able to speak up, often we're not heard if our voice sounds shrill, if it sounds judgmental, if it sounds self-righteous. And so I think this helps us to be able to harness that energy that's produced by that moral outrage, and to use it to guide our thinking and our advocacy in ways that are actually constructive. So to be able to step back and say, well, what else is possible here? You know, where are the additional resources? How do we advocate for increasing the availability of PPE? What are those strategic decisions that we need to engage? Maybe we need to work with our professional organizations. Maybe we need to work with our leadership in our own institution. Maybe we need to create allocation protocols for how we will allocate this scarce resource. All of those may be ways that can move us out of that sense of feeling completely powerless as well, that there's nothing we can do, to being able to recognize that in the midst of this incredible crisis in healthcare right now, that there are still opportunities for us to actually use our commitments and our passion to our patients and to our profession to create good, despite the limitations that are currently in front of us.
Well, and it tells us that we can't do any of that very successfully if we're in a fast system of information processing.
Right.
And so as we learn how to take to use these very basic skills, but they're grounded in brain neuroscience, as we use them to bring ourselves back into the slow process, we can be much more effective in all of those. And so, without trying to be too cutesy about it, I was telling Cinda before we started that I've started to posit the idea of calling these skills PPSs, because they're protective, personal protective strategies, PPSs. So, and they're always with you. No one can take them away. They never get depleted. They're yours to own and yours to share. So I hope that you take that with the spirit that it's offered to really develop your PPSs.
So I want to thank Dr. Leach for joining us today, and I hope that you will take something from this brief segment that will support you in responding, as you do every day, to the ethical challenges and to the reality created by the COVID-19 pandemic to support you and your integrity and your well-being. Thank you for what you're doing every single day on behalf of all of us.